All right. So today we are going to be talking about bones, specifically the skeleton, bone health, and disorders in treatment. So first, when considering the organ systems of the body and their function, I think it's fair to assume that the skeleton does not often come to the forefront, which is kind of interesting considering that it is one of the largest organ systems of the body. The skeleton, which is, of course, comprised of bone, is a supportive and protective structure that is made up of protein, collagen, and minerals. With the support of tendons, ligaments, and muscles, the skeletal system provides the basis of support for movement and to give our bodies the opportunity to be upright rather than just be a blob. In addition to support and protection, the skeletal system also acts as a reserve storage for minerals necessary for bodily functions. As you can see, there are five categories of bone. To start off with are the long bones, such as the humerus or femur. As the name suggests, these bones are longer than they are wide, and they are primarily composed of compact bone with spongy bone in the ends where it's kind of knobby looking. The short bones, such as the carpal and tarsal bones, which are the bones of the feet and the hands, are roughly cubic in shape and are composed of a thin, compact layer of bone surrounding spongy bone. And I'll get into what compact bone is and spongy bone is in just a little bit. The purpose of these bones is to provide support, and they are in areas that don't move much. So think about like the palms of your hands, the soles of your feet. The next set of bones are the flat bones. Those are the bones like the sternum or the skull or the ribs, and they serve primarily for protection. The irregular bones, as the name suggests, are irregularly shaped. There are many different irregular bones in the body, and they all have unique functions. The vertebrae, which are the bones in the spine, provide structure and support as well as protection for the spinal cord. The small bones of the ear, called ossicles, are necessary for conducting sound waves so that we can hear. There's also the hyoid bone, which sits in the neck and supports the tongue and is involved in swallowing. And lastly, we have the bones. They are small, round, and act like a part of a pulley system. They're generally found inside a muscle or tendon or near a joint, and they provide stability to that joint. The most well-known sesamoid is the patella or kneecap. There are many other sesamoids throughout the body as well, such as under the first big toe on your foot, and there's even one in the ear that protrudes from the incus, which is one of those ossicles, inside the inner ear. I do want to preface on these next few slides that I don't expect you to remember or memorize all this information, but I just kind of wanted to give some background info that might help you understand more about what the bone's function is. So there are several different types of bone tissue. Um, Starting off, bone can be either spongy or porous, or spongy bone, or condensed bone, or compact bone. Spongy bone is more porous than compact bone and kind of looks like a sponge. This spongy tissue decreases the weight of the bone, and within those empty spaces of bone, you will find bone marrow, which is critical for the development of blood cells. Compact bone, on the other hand, is composed of osteons, which is a type of cell, and I'm not going to talk about that for a minute more, or not for a little bit more. It's a dense bone tissue, and therefore it weighs more than the spongy bone. It is a lot stronger than spongy bone, and it helps protect that spongy bone from damage. It's also thin, very vascular, meaning that it has a lot of blood vessels. And when a bone is damaged, that helps heal it. Sorry, I lost my space for a moment. Um, the periosteum, which is that very outer layer of bone, as you can see in the diagram, this is the very vascular portion of the bone. And this is what helps direct bone healing if the bone is damaged. The endosteum is that inner portion of bone right next to the medullary cavity. And again, I don't expect you to remember the names of these, but it is also a thin layer of bone that protects like the interior of the bone. Um, and then the next portion is the medullary cavity, which is not technically bone tissue. It's just an empty space that is filled with bone marrow. And again, that's where the blood cells are produced. Um, Bone marrow can be classified as either red bone marrow or yellow bone marrow. Red bone marrow is going to be what produces blood cells. And the yellow bone marrow stores fat and stem cells, and those stem cells also become bone. And as we age, our red, or not bone, it becomes blood. And as we age, our red bone marrow gradually is replaced by yellow bone marrow. Um, it's interesting to note that bone marrow is also susceptible to a condition called edema, which we frequently associate with people who have swelling in their legs. But it can happen in the bones, typically after trauma, like if someone says they bruised their tailbone, there can be swelling in the bone. It's very painful or can be very painful and limit movement, and is generally treated with like anti-inflammatories and pain medication and rest. And the bone that is most commonly a victim of this edema is the talus or the heel bone, since we're on that part of our body all the time. As for the rest of the anatomy of the bone, since blood products are primarily made within the bone, it is highly vascular, meaning it has a lot of blood vessels. It is also innervated, which means it has nerve running throughout it. The purpose of the nerves in the bone is to relay messages from the central nervous system to control blood pressure, as well as telling the osteons, which are bone cells, what to do. And I had mentioned earlier, or I hadn't mentioned earlier, there's the space where the blood vessels and the nerves are is called the Haversian canal. Not that I expect you to remember that, but that's that space there. As far as the osteons, they are part of the compact bone that provide protection and structure. There are different types of osteons, and they each have different functions. The osteoblasts are responsible for the creation of bone tissue, either whether it's new bone or repair of existing bones. Um, then there are also osteoclasts. They are responsible for breaking down bone tissue to release minerals to the body when it's needed for cellular function. It is also they also break down old and damaged bone, so that way the osteoblasts can come around and replace it with healthy bone. Osteocytes are a result of the osteoclasts that become, for lack of a better term, trapped by the tissue that they create. Um, they also send out signals to the osteoclasts and osteoblasts, giving direction for what those cells need to do. I don't expect you to remember those names, but I think it's important to realize that, there are cells that break bone down, there are cells that build bone up, and it's happening all the time, all day long, every day. So now that we've covered what bone is, I kind of want to talk about and what it's supposed to do. I want to talk about the important components of bone health. And although this is not a comprehensive list, it does cover some of the most important aspects of bone health. As with most health-related topics, diet is key. The phrase "you are what you eat" does come to mind. A balanced diet of carbohydrates, proteins, and fats is, of course, important for overall health. But in addition to this, there are several micronutrients that are important for bone health. Thanks to public service announcements, most individuals are aware that calcium is a major component of bone health. It is recommended that adults consume approximately 700 milligrams of calcium every day. Calcium is necessary for the actual structure of the bone tissue, as it makes up slightly less than 40% of the total weight of bone. Bone also houses 99% of the body's calcium storage. Calcium is not only important for bone structure, but it is also necessary for cellular function. And since it is a key component of cellular function, if there is not enough calcium in the diet, the body will instruct the osteoclasts to break down bone tissue to release the calcium into the bloodstream to make up for that deficit. While this is okay in short-term fixes, when this happens chronically, um, it can lead to conditions such as osteoporosis, which I will discuss a little bit later on. For this reason, blood draws on their own are not enough to determine whether or not a client is getting enough calcium in their diet. And as with anything else, there is such thing as too much of a good thing. When there's excessive amounts of calcium in the bloodstream, there can be complications such as kidney failure or dysrhythmias of the heart. In some cases, the body starts putting calcium in random places, such as heart valves, which can cause, calcification and cause the valves not to work so well, resulting in heart problems. And this calcification actually can be part of just the normal aging process as well. Hypercalcemia as a result of diet is very rare. It's generally a product of dysfunction of the parathyroid, which is one of the hormone glands, or it could be a result of some forms of cancer. There is the potential for oversupplementation, but again, this is pretty rare. Signs of hypercalcemia are pretty nonspecific, such as polyuria, which is peeing frequently, fatigue, and it does require blood testing for diagnosis. On the opposite end of the spectrum, hypocalcemia is a condition in which there is not enough calcium in the blood. And as I mentioned before, this can be corrected by pulling calcium from the bones. In some cases, the body isn't able to pull enough calcium out of the bones, or if the body excretes too much calcium through urine, it can result in, also nonspecific symptoms such as fatigue. So unfortunately, with a lot of conditions where the symptoms are nonspecific, it does require diagnostic testing to determine what the issue is. And the most common causes for hypocalcemia are, of course, dysfunction of the parathyroid, kidney disease or failure, or vitamin D deficiency. Foods that are high in calcium are foods such as dark leafy greens like kale, dairy products, or bony fish such as sardines or anchovies. Some foods have calcium added to them, such as soy and almond drinks. And although spinach does have a high amount of calcium, it is in a form that is very difficult for humans to absorb, so it's not really a great dietary source for calcium. Moving on to vitamin D, it is recommended that the average adult consume 10 micrograms every day. This is a fat-soluble vitamin, meaning it needs fat to be absorbed, and it is stored in adipose tissue. Because it is stored in adipose tissue, it's not actually and not water soluble like a lot of other vitamins. It isn't excreted through the urine very easily, and it can cause toxicity if it is there's too much present in the body, which of course is also rare, but it does happen, especially if someone's is taking a supplement. So generally, people who are taking a significant amount of vitamin D should have frequent testing to make sure that that level is not getting too high. Let's see. Vitamin D, however, is necessary for absorption of calcium in the gut. And without enough of it in the diet, the body will end up excreting calcium through the urine, which can also lead to kidney stones. When there is not enough vitamin D, it also can lead to bone weakening, fatigue, immune dysfunction, muscle aches, cramps, and bone pain. And unlike most other substances in the body, we are actually able to create our own vitamin D through UV exposure. But due to, lifestyle or, where you are located, we can't necessarily make enough vitamin D with our level of exposure to the sun, whether you're not out in it enough, or if it's, winter and it's just not the right amount of UV rays that are available outside. Um, so sometimes if you're not getting enough UV rays from the sun, it's important to supplement with, either or changes to your diet or with supplementation. And I also do want to mention that the UV rays that stimulate vitamin D production do not pass through pane window glass. So even though sitting in front of a window where the sun is coming through feels great, it's not going to help create vitamin D. And since vitamin D is crucial for calcium absorption, the public health department made a push in the 1930s to fortify milk with vitamin D to prevent diseases and disorders that can occur from that deficiency. Other foods that are rich in vitamin D are fatty fish like salmon and tuna, as well as egg yolks. And there are some fortified foods such as orange juice and cereals that also have vitamin D in it. And then, as I mentioned before, protein is necessary for bone health. Proteins are broken down into amino acids, which are then used to create other proteins the body needs, such as muscle, that supports the skeleton. The stress that muscles and tendons put on bones signals the bones to strengthen themselves, to build themselves up. And the amount of protein an individual needs every day is about 8/10 of a gram per kilogram of the individual's weight. So if someone was 220 pounds, they would need approximately 80 grams of protein a day. Foods that are rich in protein are, of course, lean meats, eggs, dairy, poultry, fish, lentils, beans, nuts, seeds, and soy products. And then back down to the micronutrients. Magnesium is necessary for bone formation and mineralization. So it's one of the other minerals that goes into the bone. It activates vitamin D, which in turn increases calcium absorption. It can also be used to slow down bone loss. Low magnesium levels has been linked to an increased risk for osteoporosis, especially in postmenopausal women, and it may also contribute to bone loss when you don't have enough magnesium. Magnesium-rich foods include dark leafy greens, nuts, seeds, grains, and some fish. So a couple other micronutrients that are important for bone health are phosphorus and potassium. Phosphorus works with calcium in building and maintaining bones. The recommended amount is 700 milligrams per day for the average adult. Too little phosphorus in the diet can result in muscle weakness, respiratory failure, cardiac complications, and neurological changes. However, excessive phosphorus consumption can result in bone loss, which seems kind of counterintuitive, but in excessive amounts, it can lead to lower calcium. Elevated phosphates is generally associated with kidney disease since the kidneys are not able to excrete that extra amount of phosphate or phosphorus. And phosphorus can be found also in protein-rich foods. And potassium is seen as kind of a protective element. It can offset calcium loss by acting as a buffer against metabolic acids that would break down bone. The average adult needs approximately 2,600 milligrams to 3,400 milligrams per day. And some potassium-rich foods include bananas, apricots, potatoes, avocados, beans, and leafy greens. And I know that was a lot of information. I don't expect you to remember like the RDAs, but what I want you to take away from this is that a varied, balanced diet is really important for our clients. If we have clients who are very picky about what foods they eat and we can't get them to try new items, it would be important to talk to their provider about the possibility of adding supplements to their diet just to make sure that they are getting the required nutrients. Moving on to exercise. Exercise, specifically weight bearing, is important for bone health as it encourages strengthening of the bones. It also slows bone loss in adults, and as we age, we do lose more bone. In addition to the physical structure of bone, exercise is important for muscle strength, balance, and coordination. This can help prevent falls, which are also a significant risk factor for fracture in our clients. And I'm sure it doesn't come as a surprise, but abstinence from harmful substances such as illicit drugs and limitations on alcohol consumption are beneficial for bone health as well as overall health. Studies have shown that chronic use of alcohol, nicotine, opioids, and stimulants such as cocaine and meth can lead to lower bone mineral density. Bones with lower density are subject to greater risk for disease such as osteoporosis and therefore fracture. Some substances, such as alcohol and nicotine, affect the ability of the osteoclasts and osteoblasts to do their job effectively, which leads to weaker bones. Other substances, such as meth and opioids, can lead to impaired diet and therefore nutrient deficiencies. Generally, if someone is passed out from an opioid or if they're on a high with a stimulant, they're not likely going to take the time to eat and therefore they're not getting the nutrients that they need. Opioids can affect hormone levels, which also can alter bone density. And additionally, intoxication or withdrawal from substances can increase the risk for falls, which can also lead to fractures. Since these substances also affect bone remodeling, there is the complication for bone or delayed bone healing after fracture. When it comes to genetics, there are several factors that play for bone health. Biological sex actually plays a lot into bone health. Men generally have larger, stronger bones and a slower rate of bone loss as they age. Conversely, women are more at risk for developing conditions such as osteoporosis. Genetics can also be a factor in bone health. Some individuals are predisposed to denser bone tissue than others and therefore at a decreased risk for fracture. For example, African Americans generally have higher bone mineral density than other groups. Other persons might have been born with a genetic disorder that affect bone health, such as osteogenesis imperfecta, which is characterized by very brittle bones, which can break with minimal impact. While people are unable to change their genetics, they can make changes to their lifestyle to better promote bone health. For example, women, especially women post-menopause, can increase their weight-bearing activity or take supplements to help increase their bone mineral density. Or individuals with brittle bones can use adaptive equipment to help prevent falls. Um, and as well, dietary changes basically will help with a lot of that as well. Age also plays a significant factor in bone health. As we age, our bones naturally decrease in density, especially after the age of 50, which is important to note because many of our clients are over the age of 50 or getting close to it. That is one of the reasons why it's important to continue focus on varied and balanced diets despite age and to prioritize physical activity as we age. And as I said before, women in particular are at a greater risk for conditions such as osteoporosis due to declining levels of estrogen after menopause. And that condition, after menopause, that can actually it's linked to accelerated bone loss. And kind of tacking on to that are the hormones, which are created and excreted by the endocrine system. And there are many different hormones that are important for overall bone health. There are hormones that control how much calcium is in the blood, such as the parathyroid hormone, calcitriol, and calcitonin. Some hormones are important in bone remodeling, such as estrogen and testosterone. Growth hormones are also important because they help influence bone formation, like the insulin-like growth factor. Thyroid hormones are necessary for the maturation of bones, as well as they direct the maintenance of bones in adults. Cortisol, which is a stress hormone, is secreted by the adrenal gland, and it actually blocks the growth of bone. So individuals with high levels of stress are at greater risk for osteoporosis. Additionally, individuals who chronically take steroids also at risk for osteoporosis. And insulin, which is also a hormone, helps regulate bone remodeling. There are many, many more hormones in the body, some of which also play another part in healthy bones, but these are some of the biggest players. For some of our clients, they may need supplementation of these hormones. I am sure you guys are familiar with medications like synthetic thyroid or Synthroid, or even insulin, which is generally used for balancing glucose levels in our patients, but it also does play a part in bone health. And for medications, a lot of our clients are taking medications that either can negatively or positively affect their bone health. The medications that you see on the slide all actually have some risk associated with them when it comes to bone health. Corticosteroids, birth control, anti-seizure medications, some diabetic medications, some cancer medications, SSRIs, and PPIs, and even some diuretics can either directly or indirectly interfere with bone density. In these cases, the prescriber and the client should conduct a risk-benefit analysis to determine whether the risk of osteoporosis outweighs the benefit of the medications. And this is generally not the case. Um, Generally, the medications that the doctor prescribed, they need to be taken. So in those cases, they're going to want to supplement with either calcium and vitamin D supplements. Sometimes a client may need other medications like biphosphonate or bis bisphosphonates. I always say that wrong, such as Fosmex, or medications like Prolia, calcitonin, and there are also many others. And as with any organ system, it is susceptible to disease and dysfunction. Disease and disorder are often used interchangeably, and I probably will be doing that throughout this presentation as well. I think the best way to describe the relationship between disease and disorder is that all diseases are disorder, but not all disorders are a disease. Um, I'm going to start off with osteoporosis because this is one of the conditions that we see in a lot of our clients, that doesn't necessarily seem like a very dangerous or important diagnosis, but it actually is. Um, so osteoporosis is a loss of bone density. Um, Sorry, I lost my space for a moment. We already discussed that spongy bone is natural and the spaces between bone are necessary since they are filled with bone marrow. Um, the problem becomes when the holes and the gaps are too large due to that breaking down of bone or just not getting enough calcium into the diet to fill up those spaces. When those gaps are too large, it's called osteoporosis. It causes weakening and increases an individual's risk of fracture. And then, as I mentioned before, risk factors for developing osteoporosis include a nutrient-poor diet, decreased physical activity, smoking or alcohol use, some medications or treatments, such as individuals with seizure disorders who require anti-seizure medication, aging, as well as a family history of osteoporosis. Complications that someone might suffer from with a diagnosis of osteoporosis are like cervical compression, which is compression of the cervical spine, kyphosis, which is curvature of the spine, as well as fracture. Osteoporosis is sometimes called a silent disease because many people don't know they have it until they suffer a break. Testing has improved over the years, and now we can scan for bone density conditions with a diagnostic test called a DEXA scan, which uses low-dose X-ray to measure bone density. It is generally used to visualize either the spine or the hip, which are areas that are more prone to fracture due to the disease. Regular visits to the client's primary doctor or even your own primary doctor can help detect the presence of bone loss by keeping an ongoing medical history, as well as keeping up with like following up on physical changes that you might be experiencing that could indicate um, either the starting of or presence of osteoporosis. Treatment options include nutritional supplementation, changes to diet, bisphosphonates, regular exercise, specifically the weight-bearing exercise, as well as cessation of substances known to be harmful for bones, such as the stimulants, opioids, alcohol, etc. Moving on to fractures. Fractures are one of the DDS reportable conditions and can range from a minor crack in a bone to a complete break in which the bone breaks from one side to the other. As you can see here, there are several different types of bone fractures. These fracture types are primarily closed, but on occasion, the fractured bone can become displaced and break through the skin, resulting in an open fracture. This type of fracture, while gruesome, causing blood loss and severe pain, also places the person who has suffered the break at risk for infection due to exposure of pathogenic organisms. And just to kind of quickly go over the type of bone fractures, a transverse break is when the break goes straight across the bone and is usually caused by a direct blow or impact. A linear fracture runs parallel to the length of the bone and is most common in skull bones, which we sometimes see after falls. An oblique fracture is diagonal through the bone and is generally caused by falls or trauma, especially when an individual lands on an angle, and it's most common in the femur and the tibia. Spiral fractures are caused by twisting or by a twisting force to the bone. It can be caused by falls from heights, motor vehicle accidents, sports injuries, and can sometimes be a sign of physical abuse. The green stick fracture is when the bone breaks, but it doesn't completely break, or the bone bends, but it doesn't completely break, and is generally caused by force. And then the comminuted, sorry, bone breaks. What happens is when the bone breaks into three or more pieces, it's generally a result of high impact trauma and generally requires surgical intervention. And there can be several different causes behind why a bone breaks. Um, there could be a result of stress fractures, which are the result of repeated stress or impact on a bone, such as running or jumping. This type of fracture is most prevalent in athletes. The typical treatment for this type of fracture is rest, as it generally is just a crack in the bone. But just remember, even though these fractures tend to be small, they are still painful because the bone is full of nerves. So pain medication may be necessary in addition to rest. Traumatic breaks are caused by an external force that is greater than the structural strength of the bone. These are breaks that these are the types of breaks that do sometimes or that are sometimes result in open fractures. And this can be caused by blunt force trauma, such as when a rib is broken when someone falls, or even in extreme situations such as a car crash. Pathological breaks are a result of disease. For instance, it is often said that someone fell and broke a hip, but generally what happens is their hip broke and then they fell. This is generally due to conditions such as osteoporosis, where bone density is not enough to withstand like a person's weight or any additional weight they may pick up, which causes the break. Now, that's just not to say that all hip fractures are due to osteoporosis, but especially with our older clients, sometimes the break is first in the hip and then they fall. In some instances, like osteogenesis imperfecta, what happens is the bone is so brittle that it just breaks base with like simple movements or with slight physical injury. Results from bone fracture can range from blood loss, injury to other organs such as the lungs when a rib breaks, and stunted bone growth if the fracture occurs near a growth plate in an individual who has not finished growing. And of course, pain is also a significant feature of bone breaks, so pain medication is generally necessary. Um, Rest may be necessary for healing. Sometimes some more invasive treatments are required, such as splinting or casting. And in some serious situations, surgical intervention is necessary, including placement of rods, pins, or plates. So osteomyelitis is a serious, painful infection or inflammatory response of the bone. It is often caused by bacteria requiring antibiotic treatment. There are about 4 stages of classification, described by the level of containment of the infection. Healthy bone is generally resistant to infection, but bone that has been traumatized or has blood loss is at a much higher risk for developing infection. Stage 1 is when the infection is confined to the medullary cavity of the bone. So that's that center portion of the bone. Stage 2 infection is where the infection is superficial, it's just kind of on the outside of the bone, and is like also can affect some of the surrounding soft tissues. A stage 3 osteomyelitis, this infection has spread through the bone, but it can be surgically removed without stabilizing the bone. A stage 4 osteomyelitis infection has diffuse spread. So what that means is that the infection has spread throughout the bone to a point that surgical intervention is no longer they're not going to be able to cleanly cut out the infection. That's very difficult to treat. It's going to require significant antibiotic administration, and sometimes requires more aggressive treatments such as amputation. At that stage, individuals might also suffer from sepsis, which is an infection of the blood, and it puts them at greater risk for death. As mentioned, treatments for osteomyelitis include pain management, antibiotics, anti-inflammatories, and as I said, occasionally surgery is necessary. So bone cancer, um, which is obviously a cancer that develops in the bone, um, and even though any bone in the body has a potential to become cancerous, it is more common to see cancer in the long bones. Now, the first type of cancer, the osteosarcoma, generally affects younger individuals, especially during growth spurts as new bone cells are rapidly being produced. It is often aggressive due to the rate of growth, and treatment typically involves surgery, chemotherapy, and sometimes radiation therapy. Chondrosarcomas are more common in adults, and it generally starts off in the cartilage cells that are attached to the bone. It is the second most common type of bone cancer, and it usually starts in the pelvis, chest, arms, or legs. It's typically treated with surgery followed by reconstructive surgery. Next is Ewing sarcoma, which is a rare aggressive bone cancer found in individuals of all ages. It does have a high survival rate, provided that the tumor is found early and removed. Um, Treatment, like the others, involves chemotherapy, radiation, and surgery. Chordomas are a rare malignant tumor that grows on either the spine or the base of the skull. It is slow growing, but due to its proximity to the nervous system and other important structures, it is a dangerous cancer. It does also have a tendency to come back after a person goes into remission. Treatment is generally a combination of radiation and surgery, but occasionally will require chemotherapy. And lastly, I have the giant cell tumors. They're actually a non-cancerous tumor, but they do grow pretty fast. They tend to grow at the end of long bones, and their presence can be painful, limit movement, and can even cause localized swelling and fracture. These tumors are generally surgically removed when they cause negative health problems, but that's about it. It's just surgery. Sometimes people can have them and not have any problems with them. So now I'm moving on to some more obscure diseases and disorders. You might not ever see anything like this in any of your homes. But first I want to talk about Paget's disease. It's still not fully, they don't know fully what causes it, but it is a disorder that affects the remodeling of bones. So what this diagram shows with the increased bone reabsorption is basically there's an increased rate of the bone being broken down. And then there is an increase in disorganized bone growth. So the bone that is put back into the place of the stuff that has been broken down is it's what's the word I'm looking for? Malformed. And so the bone does not function correctly. Um, And as you can see, it affects the most commonly affected bones are the skull, pelvis, spine, femur, and tibia. Um, since this disorder results in the increasing breakdown of bone, replaced by the disorganized bone or excessive growth of bone, it increases fragility of the bone as well as deformity. Due to this, individuals with Paget's may suffer from chronic pain, increased risk of fracture, inflammation, or arthritis around the misshapen joints. In some cases, the inner bones of the ear can be affected, resulting in hearing loss, and abnormalities of the skull can cause chronic headaches. This disorder generally affects individuals over the age of 40 who are of Anglo-Saxon descent or individuals with a familial history of the disorder. For treatment, some medications can be prescribed to slow down remodeling, such as bisphosphonates. In cases of malformation, surgery may may be needed to reshape the bone. And like other disorders, a balanced, nutrient-rich diet as well as exercise will promote good bone health. Moving on to rickets. This disease used to be more prevalent prior to the introduction of vitamin D into fortified foods. It primarily affects children, and in some cases, it can be the result of a genetic variant. Since rickets is generally caused by a lack of vitamin D in the diet or deficiencies in calcium and phosphates, it results in soft bones, much like osteoporosis. It is different in children, though, because their bones are rapidly growing. So they're just basically creating these very large or longer, weaker bones. And as a result of that, you can see that there are like bends in the long bones. So you can see in that first image there, the femur is bowed. In the second image, both the femur and the lower leg bones are bent. And then in that third image, it's just the lower legs that are bent. Um, Regardless, it can cause pain, it can cause deformity. Um, but it is pretty easy to treat. Changes to diet, as well as adding supplementation of the missing nutrients, can correct rickets. In severe cases, though, surgery may be needed to correct the bones. And again, like I said, the symptoms of rickets are like pain, deformity, complications with teeth, poor growth and development, and then fragile bones. And lastly, I guess I'm running a little bit fast. I apologize for that. But lastly, I wanted to talk about blood disorders since, blood products are built in the bone marrow. And first is a condition called MDS or myelodysplastic syndrome. This occurs when the stem cells that are supposed to grow into healthy blood cells um, don't do it correctly. And I think you can see that in that third picture there, or the second picture there. This results in abnormal or immature blood cells that don't function correctly, which leads to nonspecific symptoms like fatigue and shortness of breath. It is seen as a precursor to AML, which is a type of leukemia. And as such, it is generally treated as a cancer with transfusions, targeted therapies, stem cell transplants, or chemotherapy. And you might also hear this as like a bone marrow transplant. As for leukemias, these are cancers that are the result of overproduction of abnormal white blood cells. Um, and what happens is they overcrowd the healthy blood cells, so they can't do their job. And since the white blood cells are not, since they're not working appropriately, they can't help someone if they get sick. So there's also decreased immune function. And like the MDS that can become a leukemia, it's treated in much the same way with transfusions, targeted therapies, um, bone marrow plants, or chemotherapy. And then lastly, I have wanted to discuss anemias. They're fairly common. They can result from a lack of iron in the diet, but they can also occur in instances of blood loss, like such as with a fracture or other bone marrow problems or chronic disease. Um, Basically, what happens is not enough red blood cells are produced, and it can cause non-specific symptoms such as fatigue and shortness of breath. Um, this can be diagnosed, of course, with a CBC, which is a complete blood pan or comprehensive blood. Gosh, what's the word, Jen? I'm forgetting. Basically, a blood panel. Um, it won't tell you exactly the specific type of anemia, but it'll identify that there is a problem, and further testing at that point would be necessary. And depending on the cause of anemia is how the doctor will determine how to treat the anemia. For someone who has an iron deficiency anemia, they will just supplement with iron in their diet. If the anemia is caused like with issues with bone marrow, sometimes a transfusion is necessary, or sometimes just new medications needed to be added. So that is what I have for you today. Does anyone have any questions or thoughts?
I guess I was just gonna circle back because we have a few minutes and and share, that for our clients who really struggle with mobility, like for an individual with cerebral palsy or severe epilepsy, um, one of the things that is done to help promote strong bones is finding a way to help them do weight bearing, right? So um, a lot of those clients use things like a gait trainer or even just a standing frame, just to help them be bearing some weight for a little bit. And it is really helpful to keep their bones stronger and their hips stronger, and for their joints. So those are some of the things that those clients may use to help with that weight bearing. But also, just I know we've mentioned this in other classes, but a lot of our clients take anti-seizure medications, either because they have epilepsy or they may take them for other reasons off label, like as a mood stabilizer. And it's very, very common for anti-seizure medications to lead to osteoporosis, particularly for our clients with epilepsy who've been on those medications like for their entire lives. They're very, very prone to having osteoporosis. And one of the things that we have to always be very mindful with, for our folks who don't have good mobility, is if we're helping with any kind of repositioning or transferring, that we're aware of if they have osteoporosis or if they have very fragile bones, so that we know to move them very gently, and be thoughtful and careful about those transfers, or even just repositioning them in bed. Some people can have osteoporosis that's so severe that just moving them around, you can actually fracture a bone. So it's just something we want to be very aware of. Hopefully, you know what your clients' diagnoses are so that you can be careful about those things, but also find ways to improve their bone health when we have the option to do so.
Thank you, Jen.
You're welcome. Did everybody sign in? Make sure you do if you haven't yet, okay? Because we'll probably log off here. Thank you, Lori.
I have two jobs, and one I'm an administrator, and I signed up for this just because I wanted the education. But when I found out it's a CEU, I know it could also count for my other job. Is that okay to have you guys send it to both?
Yeah, I noted it, Jennifer. I got you down to send it to both your employers. Yeah, and that's great. So
Awesome. Thank you.
awesome. Look at you. You're such a hard worker. But yeah, I'll take care of that. Deja, gotcha. I got you too, Bobby. Did anyone have any questions related to bone health or experiences? No? I'll add one more quick thing on, and I used to tell kids this when I taught a health class for children. It's about the phosphorus and the calcium, and I know Katie talked about it when she was discussing nutrition, but phosphorus and calcium compete for access to your bones. So if you are trying to make sure you get enough calcium, it's important that if you're going to drink any kind of soda, which is very high in phosphorus, that you save that for after you eat your high calcium foods or drink your milk. So if soda is kind of a treat and you're going to have a meal, you should do like drink your milk first and then have your soda later. That was something that I was taught by a doctor a long time ago. Avoiding soda altogether is a great way to protect your bones.
Not always realistic, though.
No, because we kind of like it.
Yes, treats are important too. Well, thank you everyone for joining us today.
Yeah,
Thank
thank
you.
you, Katie. You did a great job. Lots of wonderful information.
Thanks.
Yes, great job, Katie. Thank you.